With the evolution of personalized medicine and with lots of things are multifactorial, right? And we have our
Yes, of
genetics,
course.
we have our environment, we have our lifestyles, and so many things. There's a lot of need for interdisciplinary conversations.
Mhm.
Um, um, how do you hope to see interdisciplinary conversations happening among doctors? I think of conferences like ASCO and conferences like San Antonio Breast Cancer Conference and others, and I don't see a lot of bridges between specialties, but it
Mhm.
seems like with the way that medicine is evolving, especially with machine learning kind of picking up insights, that there need to be more conversations between specialties, but there doesn't seem to be enough time in the world to do it. Do you have
Yeah.
any thoughts on how we can kind of bridge those
Well, I
gaps?
think it's really important, and part of that is, with a lot of the novel therapies, they have side effects, and some of them have visual side effects. So we got to bring in our optometrists and ophthalmologists, and some of them have high blood sugars. We got to bring in our endocrinologists and so forth it goes. And so it really is a multidisciplinary team, not to mention just people within the cancer center, our surgeons, our radiation oncologists, our dietitians, social workers,
Mhm.
palliative care. I mean, I'm leaving out so many people, but the idea is that we all have to work together with the patient as the center, right? And then everyone kind of surrounding that. And that can be really hard because, as you said, we're busy. And I think we just chip away at it little by little. But for patients, I always urge them to understand that it's a big team, and not to be afraid to ask their oncologist, to have those conversations, right? Because I think it's so multidisciplinary, and ASCO brings together a lot of people, which is amazing. And I think as it grows, we'd like to see more, again, that ancillary, those people that are also part of it. But we have we have great, I've seen some palliative care here people and nurses and social workers, a lot of patient advocacy organizations, but it will take time.
Yeah. Well, it's been great talking to you. Thank you so much for joining us on MD Newsline.
Thanks for having me.